Hello. In this video, we will be discussing an intestinal bacterium of medical importance, Shigella. We will present its microbiological characteristics, its pathogenicity, and the methods used to diagnose it. The Shigella genus includes pathogenic bacteria that are specific to the human digestive tract. These bacteria are exclusively human and cause an acute diarrheal disease known as bacillary dysentery. Transmission occurs mainly via the fecal-oral route, either from a sick person or a healthy carrier, explaining why it spreads so easily in environments with poor hygiene. In regard to antigens, Shigella are gram-negative, immobile bacilli, with several serovars of medical interest: Shigella dysenteriae, Shigella flexneri, Shigella boydii, and Shigella sonnei. As for the substances produced by Shigella, the bacterium mainly produces Shiga toxin, which has enterotoxic and neurotoxic effect. Let's move on to the pathogenicity of Shigella. Transmission is fecal-oral, usually through contaminated hands. The incubation period is short, around 24 hours, and the clinical presentation is dominated by a dysenteric syndrome with frequent mucus and bloody stools, associated with abdominal pain, an infectious syndrome, and a risk of dehydration. The diagnosis is based primarily on direct diagnosis by stool culture, which allows Shigella to be isolated and identified. We will now discuss the pathophysiology of Shigella infections. Contamination occurs through the ingestion of water or food contaminated by the feces of infected individuals or healthy carriers. Once in the intestine, the bacteria attach themselves to the intestinal epithelium, the first essential step in their adhesion, invasion, and production of toxins, which cause the digestive symptoms characteristic of bacillary dysentery. After attaching to the intestinal epithelium, Shigella bacteria migrate through the epithelium. This cellular invasion is made possible by the expression of specific genes, which enable the bacteria to penetrate epithelial cells, multiply, and cause tissue damage responsible for clinical symptoms. As for prophylactic and therapeutic measures for Shigella infections, prevention is mainly based on controlling fecal contamination and strict adherence to food hygiene practices in order to avoid contamination by feces. Treatment is primarily based on rehydration, which is essential to compensate for fluid loss due to diarrhea. Antibiotic therapy is not systematic, except in immunocompromised patients or in severe cases, where it can reduce the duration of the disease and transmission. Thank you for your attention. We remain at your disposal for any further information or questions.